The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. Good morning for those of you who are here on the West Coast, and good afternoon to everyone else. I'm speaking to you today from the National Wraparound Initiative at Portland State University in Oregon, where, unusually enough for us, we're having a bright, clear, sunny day. My name is Janet Walker. I am co-director of the National Wraparound Initiative together with Eric Bruns from the University of Washington. Unfortunately, due to flu in the family, Eric will not be joining us today. I want to welcome you to our first webinar of the 2013 National Wraparound Initiative series. And this is the first one as part of our new role as a partner in the Technical Assistance Network, which is a new entity that's going to be providing TA to the Federal System of Care grantees, or also known as the Children's Mental Health Initiative grantee sites. And that Technical Assistance Network is hubbed by our colleagues at the University of Maryland. So if you are part of the System of Care grantee community, you will be, you've already found out something about that. So you will see that this is an activity that's part of the TA network. We are busy lining up the rest of the webinars in the series this year, and we have some great topics coming up. We'll have some up-to-date latest news on cost data and cost effectiveness evidence, including new information from Wraparound Milwaukee. We'll have a webinar planned on wraparound and sex offenders using the CAMS with Wraparound. And I think the next one coming up probably in January will be focusing on the NWI's new guidelines on the provision of training, coaching, and supervision for Wraparound. And there is a publication related to that now available on the National Wraparound Initiative website. Now, our first webinar that we're doing today is going to focus on assessing community support for Wraparound, and we are extremely fortunate to be joined by a team of folks from Kentucky who will be talking about their efforts to build community support for Wraparound and to assess that work using a measure developed here at the NWI. So we have from Kentucky at the state level Janice Johnston, who is Behavioral Health Program Administrator, and also some local impact program directors from around the state, including Chelsea Hobbs, Eric Antle, Mike Taylor, and Dan Hemlock. And they will be introducing themselves a little later on. We're planning to do this sort of like a panel discussion, and we'll be doing, I think, some informal kind of tag team stuff. And so they'll let you know who's talking when they get started. As far as questions go, we ask that you please use the chat function to submit questions, and we will be fielding those at the end. Technical questions we'll try to answer privately via chat as the webinar goes on, and the content-related ones, as I mentioned, we'll be doing at the end. Okay, next, please. Okay, so I did just want to draw your attention to some of the resources that we have on the website. Now, future webinars will be listed under resources. You can pull that down and find out about the webinars, as I mentioned, the ones that are going to be coming up. Recording of this webinar will also be available very shortly after we conclude, so you can listen to it, watch the slides, or just see the slides alone. And that will be, again, under the pull-down tab under Resources. You can see on our home page there's a lot of information, top news, and resources. You can keep updated on the latest wraparound research, new evaluations, new products from the NWI, and things that are shared from our members and partners. We have this periodic newsletter that goes out also that alerts people to things that are newly available and other opportunities related to Wraparound. We have been doing this about every 2 months in the past, and starting in January we're planning to do that monthly. You can see that orange box to the left in the middle. We're very excited that the NWI is sponsoring a special track at the Tampa Children's Mental Health Conference that's coming up in early March. And we just finished reviewing the proposals and had a great set of submissions. So really are hoping that people get enthusiastic about coming. We're also going to be doing 2 pre-conference trainings. One is going to focus on improving clinical services that are available in Wraparound and the linkage to Wraparound, and another, I think, on training and workforce development. We'll also be having a plenary talking about state-level implementation for Wraparound and kind of feature the experiences of some states who seem to be doing a pretty good job with that. So in order to stay up to date with NWI, I'd like to just encourage you to think about joining, and at the very least about getting on our listserv. And you can do that if you see the Join the NWI tab up there on the right. It's the second one to the right. And you can find out the benefits of joining the NWI and think about doing that too. Okay, next please. All right, so the implementation context of Wraparound. You know, when I got started with Wraparound, we were all about thinking about effective teams and what it took and the training and how to do the principles and the steps of the Wraparound process. But of course, a team in and of itself has a hard time functioning in the Wraparound environment without the help of a supportive organization. And what we mean by that is an organization that provides an adequate level of not just initial training but ongoing coaching and supervision, and that is able to work with the other agencies that are collaborating to provide Wraparound to make that team-level collaboration successful. But even taking a step back further, it's not just enough to have supportive organizations, and also what's needed is what we call the hospitable system environment. And that is a lot higher level of sort of relevant funding and policies, both at the local and even at the state level, that make it possible to do the kind of flexible funding or blended funding or braided funding that's needed, and helps to allow for access to a wider array of services and supports, and provides things like connections to advocacy, family advocacy organizations and so on, so that the system can also develop. So what we began thinking about pretty early on was the connection between you know, what it took to have an effective team and what was the level of support from the organizational and system level. So next, please. So this slide actually is from an early study. You can see it's a 2006 study that Eric was lead on, that was looking at the relationship between an early version, a very, I would say, very rudimentary version of an assessment of the community and community supports for Wraparound, and the also the connection between fidelity scores. And you can see that with a rising number of supports, there's also a corresponding rise, as indicated by those lines, kind of an overall average rise in the fidelity as reported by those different people. So as you can see, the youth and caregiver lines are more steeply sloped, indicating a greater connection between fidelity, or greater relationship between fidelity and community support. And then the resource facilitator or care coordinator line is also positively sloped, but not as much. And this is probably pretty typical because actually the Wraparound Fidelity Index is a little bit more sensitive when responded to by youth and caregivers. Okay, next please. So what we really wanted to do then was to get a handle on what is it really that needs to happen in the environment to help make Wraparound teams successful. So I'm not going to go into this in a lot of detail, but you can see there are publications that you can access if you want to find out. These are journal articles, more about the actual process. But we started with a qualitative approach, basically interviewing all sorts of people about, you know, asking team members, what do you need from your organization to make your work successful? And then asking organizations, what do you need from the system to make your work successful? So we came up with an initial kind of, I guess, a matrix describing those conditions. And then we took this to the full National Wraparound Consensus process to generate items, refine them, and group them. And then we did a study in 7 communities, and that was completed in 2008. And we did a study to assess the measure and how it performed, and to look at its psychometric properties, including its reliability and validity. And the initial study actually showed extremely good psychometric properties for the measure, and that second article, which was published in 2011, details some of that, including really good integrity to the structure that we were hypothesizing, which was one of these themes, what we're calling themes, as subscales that would combine to provide a total scale and a total score, so that the overall assessment yields a total score and a theme score for each of the sub-themes or sub-factors, the factors of the assessment. Okay, next please. Oh, I'm sorry, I skipped a little bit. So just the last point, that our goal was really to have something that could be efficient and low cost. And when we're thinking about low cost, particularly in comparison to what an alternative might be, which would be a site visit or an outside consultant coming in, which probably even for one day is going to cost more, especially if they have to travel, than administering this assessment. And that it would provide useful information to communities and also generate to the National Wraparound Initiative high-quality data that we can and do now use for research purposes. Okay, sorry, now you can go to the next one. So what is the inventory? It's basically a web-based survey and that people in the community respond to, and I'm going to have the Kentucky folks talk about their experience with this in just a few minutes. And it's got about 40 items, and they're grouped within those themes or factors, as we had mentioned, as I mentioned before. So each item has two little descriptions. So there's sort of a 0, which is described as least developed, and we don't think about this. We're sort of trying to think about it in strengths-based ways. People who are just starting are going to be not as developed. And so that sort of describes what conditions might look like in a community in the absence of any collaborative effort to provide comprehensive care for our population of children and families. And then the other anchor describes what we think of as sort of nirvana, wraparound nirvana, the fully developed system. So what it looks like when there is an effective and sort of seamless collaboration in place. And so the locally nominated stakeholders, so these would be people in your community leadership team or key people who understand what's going on with the project, rate each of the items. So, and when we talk about the items, and we're going to be talking about some of the data later on in this presentation, everything is going to be talked about on the scale of 0 to 4, 4 being fully developed, 2 being midway, and 0 being really not started yet. Next, please. So what are the themes? Again, this is just briefly. The first one is community partnership, and kind of like just to get started, do we have the right stakeholders at the table participating in making decisions about wraparound and guiding the project? And that includes families and youth, as well as systems, representatives, and agency folks, etc. So collaborative action, the second one, you know, have the stakeholders really begun to take concrete steps to translate their commitment and the wraparound philosophy into something concrete? So have they started strategic planning? Do they have policies and certain kinds of achievements as far as things around information sharing, etc.? The third area, fiscal policies and sustainability. Do we have basically funding in place to do what we want to do, and is it going to last into the future? Access to needed services and supports. Can people access the wraparound program, people who need it? And can, once they're in the program, can they have access to the right array of not just, again, traditional and non-traditional services? Can they get into them in a reasonable amount of time, etc.? Human resource development is all about, do we have the right people in the right jobs? Do we have the reasonable caseloads? And are people supported with training, coaching, and supervision? And then finally, we have accountability. Are we using the right kind of tools that can give us accurate information about how we're doing, and do we use that information to make improvements? Okay, next please. And then this is just sort of, again, going back to the website to point out that because we did this work with the CSWI, we have arranged the website to reflect information in these 6 themes, so that if you use the CSWI as your assessment, you can then go to the website and say you have a low score in a certain area, you can look up all sorts of stuff related to that theme. So one way to do that is to go to the Resources tab under Implementation Support, and you can see that you can access sets of kind of ready at your fingertips online information according to each of those topics. Next, please. And this is just kind of a sample of what the kind of thing that you might get if you click on one of those links, and sort of answers to frequent questions. So next then. And then a more detailed version of this that was worked on by Pat Miles and Neil Brown is this published, and you can order hard copies if you're interested, version from the NWI of the implementation guide. Again, also organized around those 6 themes with all sorts of useful information about how to get started, what the problems and challenges are, bumps in the roads, and how to address those. And if you are just starting out with Wraparound, we also have Appendix A and B that are self-assessments for early stage Wraparound implementation, again also organized around the 6 themes, but really intended for communities that aren't quite to a stage of development where even they might be able to use the CSWI, because in order to do the CSWI you really have to have a community team in place, and when people are just getting started, usually the number of stakeholders is just a few. So you can get those either online or as part of the print version of the book. Next, please. And then finally, just also under further resources, both the resource library, which is the second one down, and the resource guide, which is like a book of Wraparound, the 4th one down, are again have lots and lots of resources. The resource guide has articles written by a lot of the famous people in the Wraparound movement, and the resource library has all sorts of tools, techniques, and examples of things related to implementation of Wraparound. So there are things for if you're doing the Wraparound process, here's how you can organize team brainstorming or whatever, all the way down to issues about financing and 3 different state models, or actually I think we have more than that, probably about 6 different state models for financing. How can Medicaid be used to support the family support partner role? What are examples of some legislation, etc. So all sorts of stuff in the library there. Okay, so next slide, please. So now we're going to turn to the actual sort of nitty-gritty of the CSWI. And I am going to ask our Kentucky friends to, Heather, if you can make sure they're not muted, talk a little bit about using the CSWI in Kentucky. Hello? Okay, I'm not hearing anything from Janice. Are you guys talking? Hello? I'm still not hearing anything. Heather?
Yes, I'm here.
Okay, so we seem to be having some technical difficulties with contacting our friends in Kentucky. So I'm going to ask them to just speak up whenever you get able to, and I am going to, I guess, press ahead a little bit on this. I don't show you as being muted here, so we were just talking. If you can chat me if you're having any problems, because we cannot hear you, and I'll let you know if I can. Okay, so I guess I'm going to move ahead. If we can back up to some of these slides when we get our friends back on the line.
This is Chelsea with Kentucky. Can you hear me?
Yes, we can. Thank goodness. Okay. Take it away. Uh-oh, now looks like you self-muted again. I can't hear you. Okay. Hello?
Can you hear us now?
Yes, I can.
Do you want to mute my iPad?
We're not showing, maybe not showing the iPad right now. Why don't you just go ahead and talk, and we'll see what we can, if you talk loud, hopefully it'll work.
Okay, is it working?
That sounds great.
Okay, well, sorry about the problem with the slides and the audio. Anyway, my name is Janice Johnson. I am with the State Department of Kentucky with Behavioral Health, and we have been using the wraparound process in Kentucky for many years now, and we were very excited to hear about the opportunity to use the CSWI with our folks here in Kentucky. We have been using the team observation measure, and we have also used on a couple of occasions the wraparound fidelity index. And so this was just one other optional measure we chose to implement here in Kentucky for any of the regions that wanted to do that. We have 18 regions across Kentucky that have interagency councils that focus on the wraparound process, and so 6 of those regions chose to implement this in Kentucky. You can go on to the next slide. And so you can see that there are the 6 regions right there. And what we did was we actually implemented an application process for those folks that were interested, and they had to agree to have a CSWI coordinator as well as become involved in all of the aspects of implementing the CSWI as well. And I believe the next slide is yours, Janet.
Yeah, it is, and I just wanted to provide a little bit more detail. So when Janice mentioned the CSWI coordinator, the way that it works is if you're interested in doing the CSWI, you would identify someone to sort of be the lead in the local community, to identify the people who would be right to take the survey, and then also to work with them to publicize the survey and make sure that they actually follow through well, because it's a sort of a not insignificant time commitment to do the 40 questions there. They're not just sort of simple check, 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 check kind of things. You have to actually read each one and think about it. I just wanted to mention a little bit about the national picture that we have. As I mentioned, there was an early study that we did to validate the measure, and we've since that time have also obviously continued to collect CSWI data, and you can see that the scores are generally going up, most notably in the human resources area, and to a certain extent overall. We'll be talking about finance and sustainability, always a tough area, and also the progress there correspondingly actually less. But the overall, the last bar you can see, the overall average score has increased from sort of below that midpoint to sort of at or just above the midpoint. So, and I think that's reasonable actually as the wraparound movement is maturing and there are more sites. I think it's easier now with all of the resources that are available and the knowledge that we've accumulated to get going with wraparound more efficiently. Okay, so next we're going to go back to Kentucky to talk about their overall scores.
Okay, so you can see that our overall scores were a little bit over the average of the national average. One thing I did want to make note of is that you can see at the bottom there, we did have a pretty low respondent rate, and that's one thing that we did want to share a little bit more about probably later as other folks share. But I wanted to mention too that I think because we have these regional councils, they have been working on implementing wraparound for a really long time, and I think that's given us a huge kind of added strength to be able to implement Wraparound and to use the CSWI in the community because they're able to understand a little bit more about Wraparound, and they talk about it at the council meetings and all of that.
And this, Janet, just wanted to add that probably 25 is a kind of low end of ideal number of people. 19, 20 is actually pretty good. We also figure when we're doing the reporting on the CSWI, the percentage of people that you nominate to take the survey that actually complete the survey. And we like to see that be up in the sort of 80 to 85%, which is the average that we've been able to get. So part of it is how you kind of think about who is the right person to put on the list to take the survey, and then there are all sorts of other variables that come into play. Okay, next please.
Okay, so
go ahead.
Okay, so we had, like I was saying in the previous slide, our REACT's overall CSWI scores were a bit higher than the average, but as you'll see in a little bit, some of the specifics were a little bit in a few of the theme areas were a little bit lower, and I think we'll have some of the program folks talk about some of the specifics about the challenges they faced, as well as some of the opportunities they see for growth.
Okay.
Next slide.
Sure. So this is going back again to kind of the national picture, a combination of national and local. So this is an anonymous report, but this is the kind of figure that you might see if you were getting a report back from us having taken the CSWI. And the gray diamonds represent the national means updated so through 2011. So you can see, if you look at the pattern, it's a little bit wavy, and if you look down towards theme 3, so the overall mean and theme 1 and 2 are kind of lined up there, pretty close to midway, right about 2. Those are not labeled with values. The labels on the orange diamonds are the community scores, and I'll get back to that in a sec. So you can see again the national mean kind of dips down for theme 3, and then kind of comes up again, and theme 5 typically being higher overall as an average, and the others again around midway, which is very nice for the assessment as far as its properties go, that it's not getting out too close to the top or the bottom of the scale where you get a kind of distortion statistically of data. So then if you look at again, this is an unnamed community, the orange diamonds, and those sort of wing things that are on the side of that is a statistical confidence interval. So where you see space between the wings and the gray diamond, in this case will mean that the scores are higher, significantly higher than the national. So the overall mean for this community is 2.39, which is significantly higher. In contrast, you can look down there right below at theme 1 where there's overlap. So there's a difference, but it's not significant. So you can see that this is a community that's on par in certain areas and exceeding both overall and in other areas. And particularly you can see that in the area of accountability, that gap between the gray diamond and the orange diamond is particularly large. So they're doing a really good job in that area. Next, please. So this is a kind of a complicated slide. I condensed several slides that the Kentucky folks sent me into one, but I'm going to ask them to comment on this so it shows their different regions' scores on the separate themes of the CSWI. So Janice or others?
Okay, thank you very much. I'm going to have Chelsea talk a little bit right now about some of the things they saw in Region 5.
Okay, this is Chelsea. I'm with Region 5. One of the themes that we had a difficult time with, or our report showed, was flexible funds. So we do have flexible funds here in Kentucky, which is a great way to pay for services and supports for our impact kids. But yet as the program has grown, our funds have not. So therefore, our score for Region 5 was skewed a little bit due to the funds not increasing. But it has brought awareness in our region to things that we need to work on of being more creative of how to spend our funds that are available to reach all of the kids that are in our program now. So that's just one of the themes that we actually scored lower in Region 5 and what we're doing to improve it. And then I'll pass the phone to Mike, and he will speak on another theme.
Yes, this is Mike from Region 15E in Kentucky, and I was going to speak on the findings for our region on the first theme, which is community partnerships. And we're fortunate here in Kentucky to have a legislative structure across the state with 18 regional councils, and each of those are a gathering of our public child serving agencies and also a parent consumer. And we're also integrating some of our youth leaders onto those councils. So in my region, we use the council in each of our 4 counties as the participants in the survey. And so we do feel like with our strong score in the partnership theme, we think that does reflect the agencies we have at the table in our region. And that would also include our parent consumers. So we did expect a pretty good score there, and that kind of validated what we're doing in our region.
And we could probably go to the next slide. Would that be okay, Janet?
Sure.
So there were overall kind of themes about some areas that we knew that we needed to grow in. One of the major areas we're facing right now is we have just gone to a managed care system, as well as, like everyone else, we're looking at the ACA, and our state is looking at Medicaid expansion. But right now, we have across the state, we have pretty major issues with caseload size, as well as case managers not really being paid for, what they're worth and all of the extensive things that they actually do. And so that's one of the areas at a state level that we're hopefully going to be able to look at through the CSWI, is to be able to advocate for a lower caseload size, because we know through looking at the CSWI and our work with the team observation measure, that's a huge area that needs to decrease in order to do wraparound with fidelity. And as Chelsea was mentioning, the fiscal policies is an area that several of our regions had a harder time with, especially since we haven't gotten increased funding in many years, although a strength of that is that we do have some flexible funds that can be used through these councils, and so that's been great. One of the regions indicated, too, that access to services was a little bit harder. We do have a pretty large rural population, and it's fairly mountainous in many of the areas of the state, and so it's a little bit harder to get to, and some of the areas have less access to services. We do have a few big cities, but then many of the cities are really, really small. And I think you have the next slide, Janet.
I do. So I did just want to mention that in addition to, so we have the overall scores, which we looked at the beginning, then we have the theme scores, but we also report on the CSWI to the communities about scores at the item level. And you can see here, this is very typical, that at the item level, the bars on the orange diamonds are bigger because when you combine items into scales, you get a higher level of essentially statistical precision if the scale is a good one, which in the case of the CSWI they actually are. But you can see that here, again, the gray diamonds have a certain kind of a pattern, looking at these different areas of, this is the accountability theme. So you can see these are the items that they're sort of the title of the items that go into the overall score for accountability. And in this particular case, you can see that the community scored higher in quite a few areas. And again, this is areas that they are actually monitoring. So they're monitoring their outcomes at a more proficient level than average, as well as doing a range of outcomes. So those include, specifically, we ask, are they measuring the kinds of things that families and young people are interested, so you know, in knowing about. They're also doing a good job of wraparound quality. That would probably be some level of fidelity assessment. Plan fulfillment, are the wraparound plans getting done, etc. So you know, we give feedback even to the level of very specific topics. And then next, the next slide is really about, if you look across all of the data that we're gathering, what are the toughest challenges for wraparound? So the top number one tough choice, tough item seems to be incorporating youth voice into that decision-making level. That's from the first community partnership theme. And as you can see, and then also from the first community partnership theme is the community stakeholders. So that's a group of people who are invited to be kind of decision makers on the team, who are not just agency people, but representatives typically of that sort of the not-for-profit type groups in your community, or businesses and so on. So that's a tough item for people to score high on. Then you can see that the rest of them come from the fiscal area. They all start with 3, with third theme being the fiscal and policy, with this sort of number 2 difficult being removing fiscal barriers, which has to do with people getting together to, you know, allow money essentially to be used more sustainably and sort of fully to support wraparound, with the other fiscal ones also farther down. As far as the strengths, the top one is getting people to the table, which is always a good step in wraparound. It's usually a good first step. And then professional development, which seems to have gotten cut off a little bit. And you can see 3 of the top ones come from theme 5, maybe not so surprisingly, if you remember that theme 5 was the one that people tend to get the highest score on. And I think that really reflects the fact that when you have a kind of a lead agency that's driving the wraparound and that is fully invested, you know, it's somewhat natural for them to be able to kind of get high quality work going on within that one agency. It's sometimes a little more difficult to work with all of your partners to make collective decisions and get things done kind of at that collaborative level, which is, again, is quite natural. So we'll go on to the next slide and just ask our friends from Kentucky if they have any further reflections. I know we're going to talk about the response rate a little bit, and any other things that they might like to talk about.
I think this is Janice again. We're going to have a couple folks talk about what they've been doing since the CSWI was implemented and some of the changes they've made, and as well as some suggestions for increasing the response rate this next time, because we know that that was a huge issue for all of our partners across the state. And so we've been talking a little bit about how to do that this next go-around, which will be in 2014.
Hello, this is Dan with Region 15 West. And I was just going to speak to one of the challenges that we had in regards to youth voice. What we've tried to implement is developing a youth council, and there's actually youth councils across the state of Kentucky. And so for our program, as that was a low area, we focused in on developing our own regional youth council, which serves children from ages 14 on, and really trying to to get them involved in hearing their voice. The other thing that we've done to include youth is we want them at service team meetings or when we have our team meetings, and really helping the staff focus on bringing those youth and preparing those youth to be a part of their team meetings. And I'm going to pass this on to have someone talk about the response rate.
Yes, this is Eric Handel with Region 14. And I just want to comment on the response rate. I know in our region we kind of struggled with our response rate some. So we are coming up with some new ideas of how we might target specific partners on our board, how we might go about targeting those guys, and maybe with certain numbers of who would respond to the survey. But although we are very interested in the CSWI, we feel like it has a lot of potential and measurements for our region. Well, we do want to see a higher response rate within our region and are willing to try it again if we need to.
This is Mike Taylor again in Region 15 East, and we had one of our item scores which was rather low, was cultural competency, and we knew that was an area we needed to shore up. And the survey results kind of encouraged us to continue working in that area. A couple of things that we did was, of course, language can be a barrier. In Central Kentucky, we do have immigrant populations. We have a language line that we are now using with our service coordinators, so we don't need an interpreter on site that can get onto the phone call when we need to follow up on appointments with families and getting them to their supports. We also had a specialist in cultural competency come to our interagency council and speak to the stressors for new immigrant families in the community. One of the areas we looked at was the high rate of suicide among Latina girls, teenage girls. And also we've increased our efforts to have bilingual staff, and we have been able to really achieve in that area, so we're kind of proud of that. So the survey results have helped us to continue to focus on that area.
This is Janice again. One of the things that has happened recently is that we just received a system of care expansion grant, and we're going to be focusing on these regional interagency councils and how they're supporting wraparound in their community. And this is going using the CSWI across the whole state is going to help us be able to kind of determine where folks' strengths and issues lie, so we can give them a lot more targeted support. So we're very excited about that. I think that's all we have here from Kentucky.
Okay, great. So I just want to make a couple concluding comments, and then we can turn to questions. So if you have burning questions, get those chatted in, and we'll address them. Actually, this Janice's last statement brought up another thing to point out. I didn't give a slide example of this, but we do have communities who have done the CSWI twice, and that we sort of think about 2 to 2.5 years as a time that's sort of reasonable to do it over again, because that's the time that it takes to really get some progress in some of these areas. And so if that happens, then we are able to give a report that shows not just, those gray diamonds and the orange diamonds, but there's another set of diamonds that shows where you are now, where you were in the past, and it's possible to read off of there the areas in which you've made significant progress. So I'm going to look at the questions here. The first one has to do with examples of how Medicaid can be used to support wraparound. And I think the main ways are, and I'll ask the Kentucky folks to chime in on this at the end, but certainly we know that Medicaid can be used to the work of care coordinators is often Medicaid billable, and we have a list again on the website of states that have made it through their state Medicaid plans, so that the service is not just of family support partners, but also in some cases youth or young adult serving as peer support partners to youth and young adults, also billable. So I don't know, in Kentucky, how is your wraparound program financed, and do you use Medicaid for any aspects of that?
we were fortunate enough to have Medicaid targeted case management start the same time we had our first system of care grant, basically, in the early days of the Robert Wood Johnson grants in 1987. And so we have had the case management, the ability to bill for case management since that time. We're really excited about Medicaid expansion because we are going to be requesting, and it looks like Medicaid is going to pay for family peer support specialists as well as what you were mentioning, Janet, youth peer support specialists too. So that's a very exciting thing for us. And
okay.
we obviously have the regular, clinical services being paid for. Several of our regions are using in-home therapy and some of the other of the regular Medicaid, billable services.
Okay, thanks. And I have a series of questions here about stakeholder groups. So who do you consider to be core members of the stakeholders, and who sponsors via funds? So this is an interesting question. We have some publications on the website, again, that looked at this in the early times. I mean, most typically, the stakeholders in a given community ought to include people who, the systems, representatives of the systems where we find our children most likely to be, so those who be in school, perhaps special ed, main one, always mental health, usually, almost always, child welfare, usually a big partner, sometimes juvenile justice. And then we like to see, usually we'll have the agencies that are actually serving the population, and also representatives from the family and youth organizations. I would say those are probably the core folks. And then, as I mentioned, under that larger vision, we like to see people who are representing the kind of the faith community, the business community, and other community organizations who have a stake and who also serve as tremendous resources to the wraparound teams and the wraparound process. There's a couple of follow-ups specifically about faith-based organizations. In Kentucky, do you have faith-based organizations as part of the community teams or otherwise integrated in somehow to your overall wraparound implementation strategies?
No, we actually don't, and I know that that's one of the areas they talked about in the CSWI, but we have not done a very good job probably of integrating the faith-based community in our regional committees. I imagine they are often used as natural supports on the service planning process in the service team meetings, but in terms of being part of the community council, that has not happened in most probably all areas, I would say.
And I would just sort of make a more general reflection that even at the team level, the question of involving and engaging natural supports has always been, I would say, possibly the top challenge for wraparound teams. If you look at the Wraparound Fidelity Index assessment, that would certainly be true from the items that are measured there. But I do think there are places where it has worked pretty well, and what sticks in my mind was a few years back when we were working with some sites in Utah where the LDS or Mormon Church was very involved in wraparound and served as a good resource, and it actually gets to another question that's on the list, that was actually really helpful, particularly for people in rural areas where there was just a really strong faith community there for support. So just to follow up that a little bit, in Kentucky, I know that you guys mentioned and the things that you were, I really like the list of strategies that you were implementing recently, but we have a couple of questions here that are talking about what have you done in the rural areas. Do you have any more strategies to share about what's been going on in the rural areas that's been helpful? Because we know it's a challenge to, call teams together, get services, and so on. Any thoughts on that?
Dan will answer that one.
Well, our strategy really is to have our service coordinators become a part of that the community as much as they can. I want our service coordinators to be involved in any kind of community events or any kind of working groups that are going on within that community. And really, it becomes their community, and that enables the community to know better the resources, and that just kind of opens up the link to help people access resources.
Great, thanks. Another couple questions here. One, how many SAMHSA-funded SOC initiatives are using the CSWI? That is actually not something we've been tracking. I think we've had more than 60 communities do the CSWI since we started, but whether or not they're current SOC initiatives when they're actually doing the CSWI, we don't know. So I unfortunately don't even know if we could get that data, because it's just not something that we have asked in the past. Now that we're more formally part of the TA network, we'll be asking that, but we can't really do that retroactively. So unfortunately, I do not know the answer to that one. So here's an interesting question. Do you have any strategies for engaging community members who may not be supportive of Wraparound based on misinformation they have been given? Any thoughts on that from Kentucky?
This is Dan again. It's really just education, and getting out there and talking to the folks and letting them know who you are and what you do and how the agencies can work together collaboratively. So it's really just getting out and talking to the folks is what we found in our area.
And I mean, our experience more broadly with the National Wraparound Initiative is, I mean, if the skeptics are people who are kind of in the more bureaucratic end of things, that cost data is always a very good way to introduce and talk about Wraparound to them, because really there is a very steadily accumulating body of evidence that Wraparound can reduce the costs of care for children who are certainly at risk and sometimes, you know, initially in out-of-home placements. So we do have a bunch of resources on the NWI list, webpage about that, and we are continually updating. So that's really good. The evidence base, people a lot of times will use the various materials that we have that show the evidence of Wraparound's effectiveness. Also, you don't just want it to cost less, but you want it to be good and to serve your purposes. So we find that people will take some of that information, they might integrate it into their grant proposals or their community presentations, or when they go to talk to their legislators or other people, or just hand them something that they've printed off from our website, that can be really helpful. So, go ahead.
Janice again.
Mm-hmm.
We also have, because of our statewide infrastructure of the regional councils, we also have a statewide interagency council that oversees these regional ones. And so we have statewide leaders that are very invested in Wraparound as well from all of the various child-serving agencies. And that has really provided a lot of support to implementing Wraparound within the communities to have that state-level support.
Okay. So we got that question. I'm just going down the list here. So it says here, well, this question I don't really understand, unfortunately. I'm not going to be able to even ask that one. So what are specific strategies that Kentucky will use to increase community stakeholder participation in their regional teams? So I guess that's kind of, are you satisfied with community stakeholders in your team? And if not, what do you think you might be able to do to kind of respond to that need?
Janet, you were speaking about natural supports, and I know that in Kentucky too, having natural supports on the service planning process has been a huge struggle for us. We have been considering having some specialized training to provide to the local communities on how to increase natural supports on their teams. But I think Mike was also going to answer this one as well.
Janet was mentioning that we do have our state council that supports the regional efforts to bring the partners together. And in some of the smaller counties, the health department, who are really part of the infrastructure, are not always able to participate, and so we can use our state council, the State Department of Public Health representatives to help us bring those folks to the table at the local level. So we try to use our state support infrastructure to help us in the community.
Okay, great answers. I have another question here. Will wraparound be covered under the ACA at all? We already mentioned that a fair amount of wraparound in various ways can be covered by Medicaid. And of course, if you're in a state that has a Medicaid expansion, then that is going to make it possible potentially to reach more, particularly thinking I have an interest in the transition age population. So some of those young people who are not in their families of origin anymore may become in particular eligible for services where they really weren't before. I don't know other things about ACA. Any other thoughts from Kentucky? I know you mentioned the ACA previously. Any other ways that you see things, I guess, expanding or new coverage coming to people because of the ACA coming in?
I would just reiterate that we're going to be having some additional service expansions, like with the family peer support, the adult peer support, and youth peer support. And so we are trying to get the word out to folks about that. We haven't finalized all the services that will be covered yet, and so we're still waiting for Medicaid to finalize that list. But we are excited that some additional services will be covered.
Okay. Looking at another question there, we have someone who's been very active with ideas about how to increase connections to the faith-based community with a suggestion, I don't know if this is exactly a question, that consumers who are skilled in community outreach and faith-based organizing, people who can do this should be identified as consultants and made available to the communities. And I actually think this is a very good suggestion. You know, the new Technical Assistance Network is trying to build capacity to be very flexible in responding to needs. So I think that this is an excellent idea for a strategy. I don't know if the network has identified already consultants who have this particular expertise, but if you feel that you do or know a good way of getting in touch with those kind of people and want to email me personally, you can find me easily from the NWI website, and I will forward that suggestion to the Technical Assistance Network. I call it the mothership or the hub, and we can see what is on tap with that. The University of South Florida is kind of handling that angle mostly, but you know, we're a group, so that would be, if you have a specific suggestion of where we could find that expertise and want to send it to me, I think that would be great. How do you address agencies promoting, quote, wraparound, but they're actually not using a tool such as the WFI to ensure high fidelity? Aha, well, this is a very interesting question. And for me, it gets back to the very roots of the National Wraparound Initiative, which that whole issue, there wasn't even a WFI really at that point when we got together, and how to distinguish kind of real wraparound from fake wraparound, because if people were doing wraparound that wasn't really the full model, it was kind of giving the wraparound name a black eye. You know, it's still a little bit of an issue that we do here, although certainly I don't think really as much as it was in the past, because in the past, really there was no definition of wraparound, you know, more than 10 years ago. So I think that problem has gotten better to some extent. The NWI is really planning at some point to be able to do a sort of an agency level audit that people can participate in to become recognized as doing high quality wraparound. And it wouldn't just be limited to doing the WIFI, but also, you know, do you have the right kind of staffing, a bunch of other stuff too. You know, it's proven somewhat contentious in the past to define exactly what it would take to be so-called doing wraparound right. But as of now, there is no national certification that you could look up program to see are they doing wraparound at high quality. So I think we're just about out of time. We have one last question here. I think it'll be our last question. Is Kentucky using a youth family assessment tool to identify needs? I guess what would it be if so? And can you identify progress between intake and discharge? How do you assess that?
Like in Region 15E, yes, we do a strength and needs assessment for each child and youth entering our wraparound program, so we can measure kind of a baseline of what the needs are and our progress. We also do a caregiver and adolescent survey at entry, and that's statewide. And we then do updated progress reports to check on progress and completion of their goals during the program. So we do monitor that during their time with wraparounds.
Is there anyone else from the Kentucky team that wants to respond to that, or are we done?
I think that's about it.
Okay. Well, we are just right at an hour, and that was our scheduled time and our target. So I just really want to thank, once again, the team from Kentucky for being willing to get up here on the national stage and talk about their strengths and challenges, as well as the strategies that they are using and developing. I learned a lot, and I'm really pleased to have gained some new information. So thanks to all of you, and thanks to the folks who have been on the webinar. Oh, I'm sorry. Go ahead, Janice.
Thank you also for allowing us to be part of this webinar. This has been very insightful for us as well.
Well, great. Our pleasure, and we hope that it's been profitable for those of you who have listened in and watched the slides. And once again, the webinar will be posted almost immediately on our website. So if you need to refer to it or refer other folks there, that's where to go. Okay, thanks again, and goodbye, everyone.